Back pain affects 8 out of 10 people at some point in their lives. This pain usually goes away with time and exercise. But for the 20% whose pain does not subside, this can be extremely frustrating, not to mention complex and expensive to treat. We understand, and that's why we've developed the Iowa Clinic Spine Center.
The Iowa Clinic Spine Center is an attempt to bring an entire treatment team together to help manage patients with back pain. As surgeons, we will find that maybe 1 to 3% of patients with back troubles may actually benefit from surgery, but there's many patients that might require other treatments. And so what we've tried to do is bring all of the treatment team together and have that work as a coordinated effort at managing all aspects of patient spine care.
All of our Spine Center specialists are trained in the diagnosis and treatment of injuries and degenerative conditions of the musculoskeletal system. Our team includes physical medicine and rehabilitation, pain management, physical therapy, as well as neurological and spinal surgery. Oftentimes, your first appointment will be with a physical medicine and rehabilitation specialist. Dr. Amy Lynch explains.
On their first visit, the patient can expect for me to take a detailed history, do a physical exam, and then come up with a treatment plan.
Pain relief for the patient will be our first priority. This will be attempted through conservative methods such as injections and oral medications from our pain management specialist.
Pain management is an area that is very important because, like we talked before, many spine problems may not be fixed with surgery, but there are many options available from pain management that can be beneficial.
In most cases, physical therapy will be prescribed to help provide relief and build strength.
Physical therapy can play a valuable role in your rehabilitation process. Your therapist will develop a core strengthening home exercise program that targets your abdominal, spinal, pelvic, and hip muscles. On your initial visit, your therapist will perform an examination, and through that examination, they will find your limitations and set your goals for the rehabilitation process. Your therapist will then give you a customized home exercise program for you to do at home to strengthen those muscles.
If pain management and physical therapy aren't working, surgery may be recommended.
As a neurosurgeon, our role is to try to address surgically treatable problems in the spine. And what we'll find is that the majority of spine problems don't require surgery, but many of them do, and many of them may be very important issues. So for instance, patients that have herniated discs may benefit from surgery. People that have instability of the spine may benefit from surgical interventions. I think there's also situations that are kind of in a gray area, and that's where the team approach is very beneficial because some patients may benefit from surgery but may not absolutely have to have it if other treatments are successful. And so by bringing that team together, we are able to identify patients that require the surgery and maybe offer surgery to those who may benefit but also have other options to explore. I think that there have been many advances in spine surgery, but at the same time, there's also been many issues that have arisen as a result of the new technology. And so I think the most important thing is having a balanced approach to that information. One of my professors years ago always said that with spine surgery, you never want to be the first nor the last to have a certain thing done. And that's where I think our expertise by bringing together this team is helpful because what we're able to do is sort through new things that come along and try to identify which ones seem to be supported as being beneficial to patients and trying to steer people away from ones that don't really seem to have a lot to offer them. And anyone that goes on the internet will rapidly realize there are many, many, many different websites out there promoting different things. But the key thing to keep in mind is that many of these things in 5 or 10 years are identified as things that have either not been helpful or sometimes even harmful. And so it's very important to keep a balanced approach. I think some of the new technologies, though, that show promise are the development of minimally invasive approaches to the spine that allow more rapid healing, smaller incisions, and less postoperative pain. Those technologies will only continue to increase over time, and I think are showing lots of promise in trying to minimize the postoperative pain and discomfort that patients experience.
If you're suffering from back pain, here are some things to consider when searching for a provider.
Well, I think the key thing that patients should look for in evaluating a treatment team for their back problems is a comprehensive approach and people that have had a lot of experience in that area. And I think that you always have to be very cautious about aggressive advertising, because if you look around the state of Iowa is underserved probably in many ways. And so I think most of the providers that are out there that are really reputable, strong physicians are going to be very busy, and I think you always have to have some suspicion of someone who is overly aggressively marketing things. Having said that, I think you want to look for board certification as one criteria to look for, and you want to look at the education and training of that team and how encompassing or broad spectrum that approach will be. Because I think if you get into a situation where you have back problems, there are going to be many different people that will need to provide care. And if you can get into a clinic that has the education and background sufficient to care for those problems, but also has an entire team that includes surgeons and non-surgeons, that becomes very important at addressing the problems, because there's not one person that's going to be able to manage all aspects of the spine. It will require a team effort.
For more information on the Iowa Clinic Spine Center, visit our website, iowabackpain.com. You can learn more about us and access a complete list of our services, including non-surgical and surgical treatment options. Under the Patients tab, you can browse our comprehensive health library filled with patient education. You can meet our team of specialists and even watch videos to get to know some of the providers. For your convenience, we also offer online appointment requests, or you can call the Iowa Clinic Spine Center at 515-875-9888.